Hello and welcome to day three. So, yesterday we covered where your knee pain is coming from. Today, we're going to dive a little bit deeper into how serious your knee pain is, and whether it's something that'll go away on its own or if it needs a little bit more help or professional intervention. So, we're going to take a look at acute, basically short term, versus chronic injuries, which are more ongoing or overuse injuries. And after watching this video, you should have a little bit better understanding of where you stand in terms of just the seriousness of your injury overall. And there's a few charts that I'm going to include in our email today that are going to summarize everything we go over. So if it feels like a lot, you can always go back and reference these as well. So we'll start with talking just about a timeline when it comes to knee injuries. We've got immediate knee injuries. So think about this as if this happened like 0 to 2 days ago, this is likely due to a sudden injury or more traumatic. And this could be something like a ligament tear, meniscus injury, or contusion, which is basically just means a bone bruise. And these might follow with swelling and sharp pain. These require immediate attention. So this is something where, if you can't put weight through it, if it's blowing up on you, this would be a reason that you'd want to go to the emergency room to get things checked out. So consider these like red, very serious. Make sure that you're addressing them in a timely manner. Now, if it's something that's been going on for a few weeks, this could be the result of overuse. It could be muscle imbalances, or mild sprains that haven't fully healed properly. So these are kind of an orange area. We want to keep an eye on them. We want to make sure that, it's not something more serious that we missed, but at the same time, it's not quite as serious as something that happens suddenly and is extremely painful. Um, Things like that. Once we get into a few months, this is more of a chronic issue. This could be something like a tendinopathy, patellofemoral pain syndrome, which we mentioned earlier in one of our previous days, or cartilage wear and tear that may develop just from repeated stress or improper movement patterns over time. Once we get into these chronic issues, they become a little bit more challenging to address because it's oftentimes a buildup of something that's happened over time, whether that's strength deficit, whether that's mobility deficit. We just have to figure out in these cases what the root cause is so that we can reverse patterns and get back on track. Because the further out that you get, sometimes the more challenging it is to correct. That doesn't mean you can't make progress. It's more important that we figure out, why is this happening? Why has this been going on for so long? And, why is this not improving? Once you get into a few years, so if this has not been going on for weeks, months, we're progressing into years. It's been happening for quite a while. This might point to more of a long-term condition like arthritis, degenerative meniscus tears, joint instability from untreated injuries. And these, if you've been dealing with it for a very, very long time, this is kind of a yellow-green situation. There's nothing urgent in terms of severity. We just need to figure out how to get you back on track, whether that's getting stronger, again, more mobile, or what we can do to reduce the amount of pain you're having on a daily basis. Because if this has been going on for a really long time, I'm sure it's getting to the point where it's frustrating, it's annoying, and you want to make some progress. So overall takeaways, just in terms of timeline, if it's more recent, it's very important that we're addressing it, making sure that, there's no serious structural damage or things like that. The further you get away into weeks, months, years, it becomes a little bit less serious, but at the same time, as I mentioned earlier, we need to get to the root cause of why you're still having pain, so we can address it and get you back on track. Whether that's mobility issue, strengthening issue, something else, we just need to have a little bit more of a plan. The next thing I want to walk through is just a quick checklist in terms of figuring out if this is something where you need to see a provider or if it's something that you can handle on your own. So, in terms of seriousness, I'm going to list off five different things, five different items or criteria. If you're checking three or more out of these five boxes, it's probably time to seek just a little bit of additional help, whether that's consulting a physical therapist, your doctor, whoever you want to see. So, I'll go through each of these. The first is pain persists beyond 2 to 3 weeks. So if rest is not helping, it's time to take action. It's time to figure out what's going on here. Next, if you're having swelling or instability, so if your knee feels weak or swollen, it's not a situation where you should ignore it. If your knee's giving out on you or if it's, swelling up after activity, those are signs your body's telling you, something's going on. Next, we have difficulty with daily tasks. So if you're struggling with things like stairs, walking, bending your knee, all these are signs that this might be something a little bit more serious because you don't want to go the next, 5, 10, 20, 30, however many years, not being able to do daily activities. That's going to make for a really long and not very enjoyable life, frankly. Next, we have recurring pain after activities. So, if pain's returning after exercise, this could signal a deeper issue. If it's fine when you're sitting still, but as soon as you start moving, as soon as you start doing the things you want to do, then that's a reason to be just a little bit more concerned. And then lastly, decrease range of motion. So if you can't bend or straighten your knee fully, you should probably get some help in doing that. And oftentimes, when it comes to range of motion deficits, it's a fairly easy fix, but you need to take action. You need to know what you're doing, and you need to work on it consistently because it's not something that's necessarily going to improve on its own. So if you're checking more than 3 out of 5 of those boxes, again, probably time to seek a little bit of extra help. It's not something that's necessarily going to take a super long time to fix or get back on track, but you need to be doing something here. Our exercises today, we're going to be doing the long arc quad. Again, you can look at this on my page. And then for mobility, we're going to be doing the half kneeling ankle mobility drill. So we're going to give the ankles a little bit of love today. Like I mentioned earlier, if you're having knee pain, it could be due to not only motion limitations at the knee, but also could potentially be at the hip and at the ankle. So I want you to have a few different tools you can use to improve that ankle mobility. That's going to wrap up everything we have for day 3. I'm getting ahead of myself. And then for day 4, we're going to dive a little bit more into specific treatment options. So hopefully this was helpful. Any questions at all? If you need anything, feel free to drop those questions in the comment, reach out to me on Instagram, whatever you need. I'm happy to help. Glad you've made it this far and excited for the last couple days to keep giving you more information about your knee health. So we'll see you in the next one.